Sharma, and tonight I'm going to be presenting to you about transplants of umbilical cord blood in adults with acute leukemia. So, some background about leukemia. Leukemia is cancer of the blood or the bone marrow, and for patients with leukemia, they have an abnormal production of the white blood cells in their body, causing unnecessary harm to them. According to the Leukemia Research Foundation, there are over 250,000 Americans currently living with leukemia. If we think about that number, it's a lot of people, and stem cell research has so much potential to help these people and other people with various diseases and illnesses. Leukemia also causes more deaths than any other cancer among children and young adults. So, two types of cancers we will be focusing on tonight: acute lymphoblastic leukemia, acute myeloblastic leukemia, otherwise known as AML, and this is leukemia that originates from the myeloid stem cell. And the myeloid stem cell has a role in producing new blood cells for the body. And this kind of cancer progresses fast. Another type is acute lymphoblastic leukemia, otherwise known as ALL. And this is leukemia that originates from the lymphoid stem cell, which has a role in the immune system. And ALL is actually pretty common in young children and has a survival rate of 85% in children, but only 50% in adults. AML is more common in adults and has a 5-year survival rate of only 40%. So cord blood is the blood that is taken from the umbilical cord after a baby is born. It's supposed to be a very good source of stem cells. There are so many advantages of using cord blood. First of all, you have an immediate availability of these cells that can be used right away for transplantation. Second of all, when you're taking these cells, there is absolutely no risk to the donor and is perfectly safe. Third of all, and most important, when you're using cord blood, there's a very low need of HLA matching between the donor and the patient, and this is extremely important because currently there are so many people who have been waitlisted for various transplants and other things, and they are in need of a transplant. And the reason that these people are waitlisted for such long periods of time is that it's very hard for them to find a suitable donor who will be a good match for them. And it's important to find a good match because without a good match, they can lead to graft failure or rejection in the body, which can be fatal. However, the disadvantage of using cord blood is that there's a lower amount of hematopoietic stem cells per unit of cord blood, so it requires more units for each transplant. Hematopoietic stem cells are the multipotent cells that can give rise to all other blood cells in the body. A hematopoietic stem cell transplant is the transplantation of these blood cells from the donor to the patient. A myeloablative regimen is really common for all patients who have a stem cell transplant. The whole goal is to destroy the blood cells, the hematopoietic stem cells in the bone marrow in order to get rid of the white blood cells that the patient had possessed. In this, patients receive maximum dosages of multiple drugs at maximum dosages that are tolerated. This oftentimes results in pancytopenia about 1 to 3 weeks after this has been administered, which means that the patient has a lower amount of white blood cells, red blood cells, and platelets. This is to be expected, though, as the goal is to destroy these cells. So, for patients having a stem cell transplant, oftentimes they have a myeloablative regimen prior to it, or they are just treated with radiation or high dosages. And the stem cells are taken from the donor and put into the patient through a regular IV, and from there, the cells enter the bloodstream and make their way into the bone marrow. Once in the bone marrow, they begin a process called engraftment, which means that that the stem cells create new white blood cells, red blood cells, and platelets that will make up for those that had been destroyed. Graft versus host disease is also a very common condition that occurs for patients who have had an allogenic transplant. An allogenic transplant is a transplantation that when a person has a donor other than themselves. This is opposed to an autologous transplant where the patient is actually able to take their own cells from a different part of their body and donate them to themselves in their bone marrow in order to produce the needed cells again. So what happens is the immune cells from the grafted tissue actually see the host cell tissue as foreign and begins to attack it as it thinks it's not supposed to be there. This causes a lot of chaos and problems in the body and can ultimately lead to graft failure or even rejection, which is a major problem. Neutrophil recovery refers to a very important aspect of transplantation as well. Once a patient is going through a transplant, all of their white blood cells are destroyed through a myeloablative regimen or any other form of radiation. So it's important to try to get these cells back as soon as possible, as without the white blood cells, the person's immune system is not as efficient as it would have been without it. So a similar study that has been done was called graft versus host disease in children who have received cord blood or bone marrow transplant for an HLA identical sibling. This study was done during a 7-year period from 1990 to 1997, and they compared the records of 113 recipients of cord blood from HLA identical siblings with the records of 2,052 recipients of bone marrow from HLA identical siblings. All of the children in the study were ages 15 years or younger, and they compared the rates of graft versus host disease, hemopoietic recovery, and their survival rates in general. They actually found that there was a lower risk of acute graft versus host disease and chronic graft versus host disease with patients receiving the cord blood as opposed to the bone marrow group. They also found that after the cord blood transplant, the neutrophil recovery rate was actually a lot less. However, the mortality was the same between the both groups. They were able to conclude that the recipients of the cord blood transplants from HLA identical siblings had a lower incidence of acute and chronic graft versus host disease compared to the bone marrow transplants. The hypothesis of this paper was that umbilical cord blood can be used as an alternative to bone marrow as a source of hemopoietic stem cells for transplantation. So in the study, there was adults who were all ages 15 years or older. All of them had primary acute leukemia. They were all in need of a hemopoietic stem cell transplant, and all of the transplants were allogenic, and they were from unrelated donors. All of the transplants were done at a total of 145 different transplantation centers along the country. So there was a total of 682 adults, all who had acute leukemia, and out of this, 362 of them had AML, and 320 of them had ALL. 98 people received cord blood, and this was composed of 46 people who had AML and 54% of people who had ALL. 584 people received the HLA-matched bone marrow, and out of this, 54% people had AML and 46% people had ALL. All of the patients received either the cord blood or the bone marrow based on their own medical history and what their doctors had thought would be best for them, as a lot of the patients were in a more advanced phase of their leukemia or were further along in their treatment. The transplants occurred during a 4-year period between 1998 and 2002, and all of the patients went through a myeloablative regimen prior to their transplant. So in the study, there were 4 main characteristics that were accounted for. First was the neutrophil recovery rate, and this was the estimated time after transplantation that it took for the patient to reach 3 consecutive days of having at least 500 per cubic milliliter of the white blood cells. Second was the chronic graft versus host disease, which was patients who had been able to survive over 100 days with engraftment were then tested to see if they had chronic graft versus host disease. Third was transplantation-related mortality, and this is death related to transplants, not because of relapse. The fourth characteristic was relapse, meaning that there was evidence of leukemia or other cancer in bone marrow or other parts of the body. So here we have the results of the neutrophil recovery, and based on the graph, there is a huge difference between the cord blood and the bone marrow. So we see a significant delay after the cord blood. For the cord blood, it took about 26 days for patients to recover their neutrophil, while for the bone marrow, it only took 19 days, so this was significantly different. For the incidence of chronic graft versus host disease, we see that the graphs are pretty similar, as for cord blood, there was a 30% rate, while for bone marrow, it was a 46% rate. This was statistically not significant. In the case of the incidence of transplantation-related death, once again, there was no significant difference. As for cord blood, there was a 44% rate, and for bone marrow, there was a 38% rate. And for relapse, there is no significant difference once again, as for both groups, there was a 23% rate of relapse. So after looking at all of the patient characteristics, it was able to be seen that the cord blood recipients were actually a lot younger, and they did way less than the bone marrow group. The cord blood recipients were also in a more advanced phase in their leukemia compared to the bone marrow.